Ever wondered how plastic surgeons fix the so-called turkey neck? That's today's topic on Aesthetic Minutes Clinical Vignettes. Hi everyone, welcome to another episode of Aesthetic Minutes Clinical Vignettes. Today we have a healthy 72-year-old patient interested in getting rid of the loose skin of her neck. She's had to deal with this worsening problem for more than a decade and has decided to finally fix it, though she wants it done with minimal scarring and with as natural a result as possible. On examination, this patient shows a severe degree of excess neck skin which conceals the underlying shape and contour of her neck and jaw, making her look aged. However, on palpation of her neck, it becomes clear that she actually has a very favorable neck shape, which makes her an excellent candidate for rejuvenation of the neck. Although most people will develop some excess skin of the neck by the age of 70, only some will acquire a severe degree of skin laxity. The reason for this has to do with the genetic makeup of an individual. Chances are, if your parents have a lot of excess neck skin in their senior years, you will also likely eventually develop a similar degree of neck aging, though there is plenty of room for variation. Now, to most people, it may seem that the primary cause of a turkey neck is simply the thinning of the skin. However, in reality, it is actually the stretching of the underlying muscle that creates this sagging of the neck. This muscle, known as the platysma, is responsible for the gradual aging of the neck that leads to the formation of bands and the midline loose tissue referred to as the turkey neck. The platysma is a superficial muscular sheet that serves to tense the neck and pull down on the corners of the lower lip, and thus plays only a small role in facial expression, which means it can be easily surgically modified to improve the neck. As a person ages, the platysma muscle and its underlying fibrous layer, known as the cervical fascia, begin to distend significantly, creating the loose neck tissue that is characteristic of aging. Managing the turkey neck always begins with a facelift because a large component of neck aging results directly from the sagging of the lower face into the neck. At 72 years old, this patient has moderate severe aging of the middle and lower face, and therefore a high smash facelift was chosen since it is best equipped to handle the extensive aging of the face. If you want to learn more about the high smash facelift, feel free to watch our video on that topic. In addition to the facelift, in order to tighten the neck maximally long-term, an anterior platysmaplasty was chosen to address the extensive sagging of the platysma muscle. In this procedure, the skin of the anterior neck is undermined and the excess loose platysma muscle is removed vertically along the midline. Then, the edges of the muscle are sutured together, tightening the neck and drastically improving the contour of the neck on profile without actually having to remove that much excess skin. Although it may seem counterintuitive, once the platysmaplasty is performed, the surgeon does not actually have to remove that much excess skin to create a sharp-looking neck. This is because the sharp contour angle of a youthful neck actually has a greater surface area of skin than an oblique aged one. In other words, the excess loose skin is necessary and should be preserved in order to create a youthful result. Of course, some excess skin is still removed, though it is often a lot less than what most people expect. A common question that I get from patients is whether or not a facelift with the platysma plication will allow just about anyone with a bulky neck to obtain a sharp neck angle. The answer is unfortunately no, because the neck is more complex than just bone and platysma. Instead, the structure of the neck varies greatly from person to person. While some individuals may have a sharp neck outline naturally, others will have a fuller, more obtuse neck due to the presence of greater tissue bulk. For example, in some patients, fat deposits lying deep to the platysma muscle create a fuller, bulkier-looking neck. In others, the submandibular glands, which produce saliva, show substantial enlargement or hypertrophy and create the appearance of swelling below the jawline in the submandibular region. Finally, some individuals may show enlargement of the anterior digastric muscles, which aid in swallowing and add excessive bulk to the submental area located underneath the chin. Before undergoing neck lift surgery, it's important to review all of these details with your surgeon. You should be well informed on how much improvement you can expect in the neck, as well as which surgical interventions may be required. Some of these added procedures, such as partial removal of the submandibular glands, can come with additional risks that must be reviewed. In this patient, because of the very favorable neck contour that she naturally has and the absence of large fat pockets, enlarged submandibular glands, or hypertrophy of the anterior digastric muscles, the surgery performed was fairly standard and combined a lamellar high-smash facelift with an anterior platysmaplasty. The patient underwent the surgical procedure under general anesthesia, which required approximately 4 hours of operative time as well as 2 weeks of social downtime. She healed well and recovered without any issues. Here are this patient's results 3 months post-procedure.